What if one day we could predict a depressive episode before it hits? What if bipolarity became something we could manage with the same precision as diabetes or heart disease? Welcome to Bipolar Talk, the podcast where we turn our bipolarity into an opportunity. I'm Clément, founder of Upstage and also Bipolar Type 2. And today we're diving into one of the topics that I really love personally, which is precision psychiatry. I'll close our way from biomarkers to guide us in diagnosis, in treatment, and maybe sometimes even prevention. And so I'm joined with Professor Alexander Niculescu, psychiatrist, neuroscientist, and director of the Centers of Precise, Personalized, and Preventive Psychiatry at the University of Arizona, and is also the founder of MindX Sciences. And I'm just going to let you present yourself, actually, Alexander.
Yeah, no, thank you very much. It's a pleasure to be with you. Before the podcast, I learned a little bit about your background, and I want to say I applaud what you're doing, and I think it's very important to have these resources, the knowledge base, the education, and so on. And I love the name of your organization. There's a lot of hope for people with who are initially struggling with these challenges. They can learn how to manage them and also how to use them in a very positive way. So glad to be with you.
So to jump into it, something I felt that is quite weird in psychiatry is most psychiatrists don't really like objective tool and test. What do you think is like this? At least it's what we've seen a lot in France.
They do not like objective testing. Yeah. Well, objective tests are very new in psychiatry. They're not new in other fields. So, for example, in cancer, cardiology, diabetes, a lot of other fields, it's just normal to have some quantitative laboratory tests, imaging, other things to go along with your clinical assessment to help inform it and so on. In psychiatry, these things are new and just starting to be used in clinical practice. There's a lot of research behind them. For example, my teams over the last 2 decades, we've pioneered this field of precision psychiatry, developing blood tests for different mental health conditions. So we can track people more objectively, more quantitatively, match them to the right treatments and so on. But it's only in the last few years after starting MindX Sciences, a startup company where the patients and doctors can access this test, that they have started to be used. So some of it is the fact that the science wasn't there until recently. Some of it is cultural. There's not a tradition in psychiatry of using laboratory tests, although there have been some DNA tests available for years that guide doses of medications, pharmacogenetic tests that inform about those. So some of it is the science wasn't there. Some of it is just, a lack of culture of using these. But and some of it is, the efforts that you're doing, that we're doing, which is to educate people about the availability of these tests, that they should start trying them out, using them, integrating them in their practice, in their care, and so on. Personally, for me, was easier to come to this because that was the mission from the beginning. My graduate work in the past at Scripps was on cancer molecular genetics. So then when I moved over to the brain and I became a psychiatrist, we brought all that methodology to psychiatry. We wanted to be like cancer, have liquid biopsies, have molecular markers, treat people for the subtype that they have, not for the broad label, match people to the right treatment so you don't have to use high doses of toxic medications that don't fit them well to try to get some effect. Just like chemotherapy was for cancer, was used non-specifically, had a lot of side effects and so on. psychiatry, we're still at that stage where we're using broad spectrum drugs non-specifically without precision tools, and people are getting all sorts of side effects. So coming from cancer, it was easier. It took a lot of work to get to this stage, but I think now we're at this stage and we can, help people. We are helping people directly in the U.S. and in certain countries, and the goal, is to make sure that not only we grow this availability of tests, but also educate people about them, just like you're doing. So.
Yeah, that's something which is really tough for us as bipolar, is like when we get the diagnosis is to find the right treatment, because you have a lot of trial and error. And I feel like most of us, we well, even think about like, should I take treatment or not, which is not
Yeah.
not what we should do. And but because most of us need treatment, at least I take my treatment every day. But how your technology
Yeah.
can help, like,
Yeah.
find the right treatment, because
Yeah.
it's really tough.
Yeah. Well, so first of all, a lot of people with bipolar, initially they have a depressive episode and they get labeled as depression. And then they get started on antidepressants. And if you're on the bipolar spectrum, antidepressants actually in the long term don't help you. They can make you worse. They can make you have mixed state or mania or be agitated or suicidal and so on. So that's a very important distinction to make from the beginning. Is this something that's just depression, or is it something that's on the bipolar spectrum? And if that's the case, then we should be using, mood stabilizers, things like that, rather than just antidepressant monotherapy. In most of the cases that get referred to us that I see in my clinic or that are being tested at MindX Sciences, that's, one of the big problems that we see. People get labeled with treatment-resistant depression. They've been tried on all sorts of antidepressants. They end up on 5, 6 different medications and are doing poorly. And when we test them, they don't have depression. They have a form of bipolar. And then our tests empirically match them to mood stabilizers. So then when their doctor gets the report, they see, well, it's bipolarity. These are the matches. They try the mood stabilizers and then their lives are transformed. Those patients do great on low doses of medications, whereas before they were on high doses of multiple medications because it was not the correct match. Now with the correct match between diagnosis and treatment, they can have, low dose of the right medication and do great, move on with their lives. The goal is to be curative, to have people on the right treatment so they can have, just move on with their lives. Obviously, for a lot of people, they also need to improve their lifestyle, improve their mentality. So, we've developed tools for that as well. A checklist that looks at life factors and gives you an improvement plan, an app that helps you, monitor things, manage things, gives you a positive sort of daily input and so on. So you have to have all those things in place. But essentially, if you're on the proper treatment, you're essentially cured, meaning as long as you stay on the treatment and improve your life and do the right things, you can just have a normal life, sometimes a better than normal life, because as you know, a lot of people with bipolar disorder have sometimes a little bit more energy than average, are more creative and so on. And there are a lot of famous people throughout history that were on the bipolar spectrum. So yeah, that's the goal, help people move on with their lives, have, successful lives. And I think we can do it. We're doing it every day over at the company.
Quick break. Can you let us a review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode.
Yeah, and I feel like it's really important for us as bipolar to accept that, of course, treatment is most of the time needed, but it's also why we can have a good life is because we will accept that we cannot do things in the same way. it took me a while, for example, to understand that I couldn't drink alcohol like my friend. I sometimes drink a glass of wine, but it's really like maybe once
You're
every 2
French.
weeks.
You're French. So what's
And
life with a little glass of wine or champagne occasionally? So, you know, that's that's okay if you're on the proper treatments and your life is in order and so on. But excess is dangerous, right? As you know, yeah.
but something that, so your test really helped to find the right treatment, but also one thing which is really tough is to accept to take this treatment for a while. And so how do you think we can help bipolar
Yeah.
people like stay in this treatment? Because I've seen that like 1,000 times. What do you advise?
Yeah. Well, I mean, first of all, by understanding that this is you have a biological predisposition to mood episodes, but it can be well managed with treatment, with lifestyle changes, with therapy, with counseling. That sort of demystifies it and removes the stigma. And again, we should look at analogy outside of psychiatry. This is just like type 2 diabetes, where you have some predisposition to having higher glucose, etc. So then you manage that. You manage it with treatments, you manage it with diet, with exercise, with having a healthy lifestyle. And then it's under control, and then it's, essentially you're cured as long as you keep doing the right things. So same thing with bipolar disorder, any other psychiatric disorder for the matter. The problem was, in the past and still to this day, there's some stigma because people were not treated appropriately. So then they got into, they got hospitalized, suicidal, did all sorts of things when they're depressed, when they're manic, and so on. But now that it can be properly identified and properly treated, there should be no stigma. It's just like diabetes. It can be well managed. And, there was also the problem that because there was no objective assessment and no empirical matching to treatments, people were broadly treated with pretty high doses of pretty toxic medications. Even lithium, which is the best medication we have in psychiatry, is a great medication at low doses. If you're a good match for lithium, low dose lithium changes your life and you don't have any side effects for it. But historically in bipolar disorders and so on, the doses that were used were very high. They were calibrated on doses used in people who are hospitalized for mania. So those were the levels of lithium that were considered therapeutic. At those doses, almost everybody gets side effects in the long run, kidney side effects, gastrointestinal, thyroid, and so on, tremors. We don't recommend that people be on high doses of medications. If you find the right match with precision approaches or empirically, your psychiatrist tries different things and you find the right medication, you can do very well on one or two medications at low doses. It's when there is no match, then that multiple medications are used at high doses because doctors don't know what to do, so they throw all sorts of things at you and so on. So shouldn't be any more stigma. People will be on the right treatments with very few side effects, and they can function well and just sort of move on with their lives and take advantage of their energy and creativity.
Yeah, thanks a lot, Alexander. I hope we can do another one because it's quite short. But thanks for everything you're doing.
My pleasure. My pleasure. Keep up the good work. And if you have any final question, I have another, couple of minutes left if you want to.
Yeah, if we can,
Yeah.
maybe like if you could change one thing in mental health, if you have a magic one, what would it be?
I have a magic wand. It's called the MindX One liquid biopsy. So that's how we're changing mental health. I think it's really an issue of just having people in mental health realize that we should adopt the best practices from other fields of medicine. That Obviously, the brain is the most complex organ. It's the most interesting organ. It's the seat of the mind and all these things. But a lot of things that are being done in other fields are very relevant to the brain, and then sort of demystifying it and treating things in a pragmatic way is achievable, is doable, and it's important, as opposed to saying, we're special, we're very different, and we're just going to sort of do talk therapy and persist in doing things the way they were done. Because things the way they were done hasn't been very successful for our patients. A lot of our patients weren't doing great. We're getting side effects. We lost a lot of people from suicide, and all those things are preventable. And nowadays, so I say that the magic, we have the magic wand. I think the MindX one, obviously, I'm biased. That's sort of our life's work. But the other magic wand is just having people be open-minded and look at other fields, look at, diabetes, internal medicine, cardiology, cancer, and realize that we can be just like that. Obviously, we're still special. We still are dealing with the mind. With psychotherapy is still something that should be done and is very interesting. But we should adopt those practices. We shouldn't be, just stuck in the past, basically.
Yeah, and I feel like in psychiatry, even more than in other field, you have all this different mentality, and I say it's a church, everybody's singing a different way, and everybody believes their religion is the best one. And what I like about your approach is kind of more objective. It's like, okay, here is the
yeah. That's a good comparison. Yeah, I do a similar comparison with like martial arts styles. I used to be, when I was younger, that was one of the sports that I did, martial arts. And then there are many styles there, but in the end, it's the same thing. Is it something that will help you in a real fight, save your life on the street, and so on, as opposed to something that you're just doing because that's how it always was done, and it looks good, and in your mind, you're a legend. Can your style actually help you in reality? Same thing with psychiatry. Do you make a difference for your patients? Are you curing them? Can they move on with their lives? That's the bottom line. So in many ways, I think sort of that a lot of the approaches are converging. If you do the right thing, you're helping people, and that should be sort of the bottom line. Are you helping people function well and move on with their lives? If you are, then that's a useful approach. If you're not, then that's a fantasy, and you're not being very helpful overall to society. So whether you compare it to the various branches of the fragmentation of religion, or if you compare it simple-minded to martial arts styles, in the end, does it work? Does it help people or not? Does it help you in reality or not? So that's what we try to do. We try to be very real and do something that can be used daily by people, and it makes a difference, basically. So I hope to continue this conversation with your team in a year or two. In the meantime, please put in your footnotes a link to our center here in Arizona. It's c4p.info, and to MindX Sciences, it's mindxsciences.com, and people can find more resources and information and publications and education at those two websites. So, merci beaucoup, Clément.
Thanks a lot.
To learn more about Bipolarity, go to our website upstage.com, HOPESTAGE.com. See you soon.